Hi, I'm Dr. Kevin Frawley with Surgical Aesthetics, and we're here today to talk about instruments. One of the things that we found as we're talking about grafting procedures, socket preservation, it really makes a big difference to have the right instruments. So we went ahead and put together the Frawley Graft Kit, which we have here today. All right, let's get started. So the first instruments we're going to talk about are the blade holders. We're all pretty used to the old blade holder we used in school, which was a flat blade holder. Well, using a flat blade holder, you really can't make delicate cuts. You can't make a nice clean turn in the sulcus. So really important that we go to a round blade holder. The one we prefer is this particular blade holder. On it we have a 15C blade, which again is a blade that we prefer over a 15 because it has a much smaller end to it. So again, you can see in using a round blade holder, you can make a slow, delicate turn without nicking the tissue. Almost impossible to do with a flat blade holder. This particular blade holder can also be adjusted to go at angles. So you can unscrew the back of it and move the tip and go at various angles. That's really helpful a lot of times, especially if you're in the posterior maxilla and you're using a 12 blade and being able to go in at a particular angle, pulling forward, this really helps. So again, this is our kind of workhorse blade holder. The other one that's in the kit is a micro blade holder. And again, you insert the blade by unscrewing the handle part way, and then the blade goes in the end. And there are various numbers of micro blades that are available, from real small single end cutting sides to dual end sides. So micro blades, especially when you're dealing with thin, delicate tissue, are really beneficial. Our next set of instruments are the periosteal elevators. The initial periosteal elevator that we really like is a micro periosteal elevator, and you can see by the end it has a very small tip. It has a serrated tip, which really helps to raise the tissue. One side is straight, the other side is slightly curved. This is great for when you're raising a papilla. One of the things we don't like to do is put an elevator in when you're extracting a tooth and smash the papilla, so that using a microperiosteal elevator, you're able to get between the teeth and gently raise that papilla out of the way. You can't do that with a typical traditional periosteal elevator because it's too thick and too fat. Again, our workhorse is the Molt. The Molt is a two-sided instrument, dual ends. One is a smaller end, the other is a larger end. The Molt has a number of uses. We also use it to deliver bone graft material to the site, but it's a great instrument for being able to raise a full thickness flap without inadvertently tearing the flap and doing a partial thickness, leaving some of the periosteal behind. The other instrument, which is similar to a Molt, is a Woodson. The Woodson can be used both as a microperiosteal elevator as well. This side is very similar to the Molt, and the other side is similar to the microperiosteal elevator. You can compare the thicknesses of these instruments to a traditional periosteal elevator, and you can see how thick traditional periosteal elevator is, looking at both sides, and how difficult it would be to especially raise a papilla with an instrument like this. The next instrument in the kit is a typical periodontal chisel. We'll use that instrument a lot of times to remove some of the granulation tissue that can get stuck to the bone, but also when you're doing root coverage procedures, this is a great instrument to be able to plane that root and remove that infected surface layer of cementum. The next two instruments are ones that we use to pack or condense the bone graft material. And as we previously discussed, when we're placing the bone graft material, we don't want to over condense it. So we're really lightly condensing it. This particular instrument is also used in our sinus lift procedures, but it works really well to place graft material in a socket. And then we have your traditional shaped condenser, which again works well, but we want to reiterate that again, you're not condensing bone graft material like you are an amalgam, you're really just lightly condensing it. You still want to see that blood flowing, sucking up into your graft material. So our next instrument is the surgical curette. This particular one has a smooth end, which is pretty typical for your curettes. We use this instrument more during suturing and membrane placement, and we'll talk about that when we talk about the technique videos. The workhorse instruments are our set of 4 surgical curettes that have serrated edges. And you can see on this edge, the little serrations really enable you to get into the socket, clean that granulation tissue off the bone, and you get a real feel for the difference of bone when all the soft tissue has been removed. You can feel the difference between the smoothness and the roughness of the bone. And it's really necessary to have different sized curettes, and that way what is the reason we have a set of 4 of them. They're slightly different angles and different sizes, so you can see these first 2, and then the size of the third one, and then a larger one for larger areas. And I really find that it's really beneficial to kind of just rotate through all 4 sizes. When you're cleaning out a socket, you're going to be able to get in some nooks and crannies that you didn't expect were there. So again, the serrated curettes, really critical to effectively doing these grafting procedures. If we leave that granulation tissue behind and we're trying to graft that area, we're not going to get the same kind of healing and the same kind of bone growth that you would if we have a completely clean socket. The next instruments that are in the kit are actually our sinus lifting instruments, and you can see this has a little mushroom effect to it. And when we're doing potentially an internal sinus lift, this is a real effective instrument to raise that sinus membrane without tearing it. The other instrument that we showed for the grafting procedure, for the bone condensing procedure, is also very useful for lifting that sinus membrane. And then once you've lifted the membrane, an instrument like this can actually go into 360 degrees around that opening that you've done to help release the membrane and then be able to pack bone into that area. Again, as a general instrument, a Minnesota retractor, really important to be able to get that cheek out of the way so you can see what you're doing. Definitely something that we found useful to include in the kit. The next instrument that's important in the kit is the tissue forceps. Your typical tissue forceps is an Adson type forceps, and we've elected to use a different type forceps that has multiple small teeth on it. You can see that these multiple small teeth have blunted tips, and the blunted tips prevent the forceps from doing tissue damage. And as we've discussed before, when you do grab the flap, you always want to grab the flap as far away from the edge as you can, because the edge where the incision has been made is where the blood supply is the most effective. So when you grab the flap, grab it deep down as far as you can to get your access, and using this type of forceps, you'll do the minimal amount of damage. You can see with a typical Adson type forceps that has 3 sharp teeth, when you go to squeeze the tissue, it's very easy to perforate the tissue, and as you do that, you're again affecting the blood supply. And as we've talked before, the blood supply is what we really want to maintain in all aspects of how we handle tissue. Our next instrument is what I consider is you can't live without instrument, and that's a Castroviejo needle holder. The Castroviejo enables you to handle the needle to do suturing in a way that a typical hemostat type device doesn't allow you to do. The Castroviejo takes one small squeeze and it grabs the needle, the next squeeze and it releases the needle. And you can see that can be done very effectively without the tip of the instrument moving at all. If you're using your typical hemostat device and you're squeezing it, it's almost impossible to keep the end of that instrument stable, which means it's very easy to tear the tissue when you're trying to navigate the needle through delicate tissue. So again, the Castroviejo, one small squeeze, it grabs the needle, second squeeze, it releases. Critical to being able to do these procedures effectively and handle the tissue well. Our next instrument, which is really critical, is your corn suture plier. The suture plier enables you to grab the flap and decide exactly where the needle is going through. Most of the time you're taking the needle, you're going towards the flap's moving, and it's pretty much a guesstimation of where that needle is going to perforate. Doing this, using this instrument, you're able to hold the flap steady, pass the needle directly through the hole in the instrument. We also use this instrument in our membrane placement, and we'll talk more about that in the technique portion. Scissors. Really important to have a scissors that is sharp so that you're not frustrated, as I often have been in the past, in trying to cut the suture, and as you're going to cut it, the suture's kind of moving out of the way. So one of the things that you want to have in your scissors is you want one side to have a serrated edge. The serrated edge helps hold the suture in place, so when you go to cut it, it's going to cut effectively without moving away from your instrument. Okay, the next instrument is the bone syringe. The bone syringe is really effective, kind of works like an amalgam delivery instrument, although we're always loading it from the tip. Never try to load it from the back end because it'll get stuck in the tube. So as you load it similar to an amalgam instrument, and then just using the plunger will deliver your graft material. This is really effective when you're in an upper molar situation. A lot of times with a lower tooth, I'll simply use the molt to deliver a large amount of material to the surgical area, but for uppers, this is really a very effective instrument. The next group of instruments are our Periotomes, and our Periotomes are instruments that I really love. Our particular Periotomes have very flexible ends so that the instrument can move down the periodontal ligament space between the bone and the tooth, severing that ligament and thereby loosening the root. Again, you can see this instrument is a single-sided instrument. The Periotomes that are double-sided mean that you have to use muscular force to push that instrument up the PDL, and I find that to be almost impossible. So the single-sided instruments are designed to use with a mallet. So you can see we have our typical mallet, and again, we don't ever want to call this a hammer. It doesn't sound so good for our patients. So when we use the mallet, again, you don't use it with a lot of force. Always let your patient know that they're going to feel a little tapping, and it's simply used like that. And 2-3 taps, the instrument advances up that periodontal ligament space. We use a buccolingual movement, which allows that cutting of that ligament. And again, we have a straight version and a curved version. And again, you can see how these tips are flexible so they can track up the ligament, but again, that means these are not elevators and you don't twist these instruments. If you do twist these instruments, they will fracture. So the third instrument in that group is our root extractor. And our root extractor actually looks just like a corkscrew and pretty much works like that. You basically screw that into the nerve canal space. That enables you to position that root so that you can use other instruments then to work around it. You don't really use it such that you screw it in and straight extract it. You use it so that you can stabilize it and use another instrument around it. The other use for this, which I find very effective, is when we're using the fracture technique on a single root, and we're going to cut that root into two pieces. You can use the root extractor to actually screw all the way down the root and then actually fracture it into two pieces and then remove the two pieces. So the other group of instruments we have are the osteotomes. And osteotomes are generally used for both implant site preparation and for doing an internal sinus lift. Our osteotomes are fairly unique in that they have a measuring device with them, so they have a depth limiting feature where you can set the depth that you want to achieve and then lock that in place. So again, when you're dealing with type 3, type 4 spongy bone, I find them very effective to use as instead of my initial drills to really diagnose the type of bone we're using. And I'll use the small one to effectively figure out what kind of bone we're using, and then potentially it will spread the bone for your implant site preparation and can be used then to lift the membrane as well. So again, that is a review of the Frawley Graft Kit. We are proud of the instruments that we've put together. We really think that this will help in the procedures that we're going to be doing and that we're going to be talking about in the course, and gives you the minimum number of instruments that you need to really do these procedures effectively.